Thank you for being with us. I'm Tim Ear.
And I'm Taylor Eaton. Welcome to your 5:30 edition. COVID shots will no longer be recommended for healthy children and pregnant women, according to the U.S. Health Secretary, Robert F. Kennedy Jr. This is news that we first brought to you yesterday evening.
Kennedy made that announcement on social media. WSAZ's Lisa Feinstein spoke with a medical expert about what this means and what could happen next.
Significant changes to immunization recommendations by the Centers for Disease Control and Prevention.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
U.S. Health and Human Services Secretary Robert F. Kennedy Jr. making the announcement on social media Tuesday.
This is new. Usually it goes through a pretty significant vetting process when vaccines or vaccine guidance has changed or adjusted, added or taken away.
Valley Health Chief Medical Officer Dr. Matthew Christensen addressing questions raised after this announcement, like how the decision was made and what comes next.
This process does not appear to have gone through the traditional process that's vetted by experts where the evidence is reviewed and the pros and cons of a particular recommendation are vetted.
A question also raised is what qualifies a child as healthy enough to not need the COVID vaccine.
I haven't seen the guidance as to what he means in this particular context by healthy. I mean, generally in the medical field, we think of healthy kids as being kids without significant chronic diseases like heart disease, lung disease, kidney disease.
While the entire scope of what will change with this decision is still unclear, right now Dr. Christensen says cost and payment for COVID vaccines could change.
Insurance companies may not pay for the COVID vaccine if it's not recommended by the CDC, but that still doesn't change the science.
Christensen says the country's medical societies still strongly encourage getting the COVID-19 vaccine.
I think what's important for listeners to know is that, again, the COVID vaccine prevents COVID, it prevents hospitalization, it keeps people who are, especially people in vulnerable populations, healthy and keeps them out of the hospital.
Christensen says Robert F. Kennedy Jr.'s announcement concerns him because he doesn't know what process was used to change the vaccine recommendation.
We as clinicians, as physicians, as scientists need to make sure that we're making decisions based on the evidence that's going to support the best possible outcome for the people that we serve.
Lisa Feinstein, WSAZ.
Dr. Christensen says right now the COVID vaccine is still covered by insurance, but you never know, that could change. There are federal and state programs to support those who need vaccines but cannot afford them. All you have to do is talk to your doctor about those.